Welcome everyone to the Northwestern Dining, Why Should I Get Vaccinated on today, March 5th, 2021. We're going to go through a few housekeeping rules before the webinar gets started. During today's presentation format, all lines will be muted. This presentation is being recorded. We are going to go through the presentation and answer any of those questions that were previously submitted to us. We do ask that you utilize the Q&A function within this Zoom webinar for any of your questions. We'll be able to answer those either live or at a later date. We also have available our text number here on the screen, 806-414-3813, if you would like to text us your questions, and we will be sure to review those and answer them here on the webinar. I would like to introduce Dr. Kimbra Balark. Dr. Balark is the Clinical Assistant Professor of Medicine with Northwestern Medicine. Dr. Balark will be very graciously providing the webinar for today. And I will turn it over to you, Dr. Balark.
Hello. Thank you so much for asking me to present today. I'm super excited to share some really great information as relates to COVID-19 and the COVID-19 vaccine. And I want to say thank you to you ladies and gentlemen out there who have joined me today for some really great information and very important information. So next slide, please. So I will begin with what is COVID-19, a brief overview. And then later I'll move into the vaccines and give more information as relates to the vaccination. So as we all know, COVID-19 is the disease that is caused by a virus known as SARS-CoV-2. Earlier on, you may have heard the disease referenced as the novel coronavirus, because indeed, this is something that we have never seen before. So novel means new, and we had never seen this particular virus before. Next slide, please. So many have wondered, where did this virus come from? And we do believe that the virus originated in a province of China, and that it came from a bat that was then transmitted to an animal host, and from the animal host to the human host. And as we know now, it can be very easily transmitted between human beings, person. Next slide, please. So I want to talk a bit about transmission. As we all know, this virus can be transmitted from just talking to another person, coughing, sneezing, laughing. Respiratory droplets that come from our noses, our mouths, can go to the person we're speaking to, and that is how it's transmitted. So as we're all familiar with the mask these days, which has really become just a part of our daily lives, this really is the best way for now to inhibit or prohibit the transmission of this virus. And of course, with the advent of the vaccine, one day, hopefully we're coming very close to a mask-free world. But for now, the masks are still very important. And I wanted to go through this schematic with you. So if you see the person on the right, this is a healthy person who does not have COVID-19, and she's wearing her mask. And she's speaking to another individual who does have COVID-19, and she is not wearing her mask. So when you're in this scenario, the probability of you still getting the disease, the transmission probability is still very high, in the range of 70%. The point of this slide is to say, if you go to the very bottom, where the healthy person is wearing the mask, and the individual who has COVID, who may or may not know they have COVID, is wearing the mask as well, your transmission probability drops to less than 2%. And even lower if you also introduce the social distancing of at least 6 feet. So I just wanted to demonstrate here the importance of wearing the mask. It will prevent the transmission of COVID-19. Next slide, please. As you know, we can be tested for COVID-19. Many people have symptoms and many people don't. Often we can be asymptomatic. However, we'll find people who want to go and get tested because they have a sore throat, or they're having a runny nose, or they've had low-grade fever or high fever or body aches or loss of taste and smell, or maybe even diarrhea. And there's others who may want to go and get tested because they were out at a friend's birthday party, which they probably should not have in the midst of COVID-19. And they learned later that one of the individuals there did have the disease. So they don't have symptoms, but they still need to go and get tested because we do know that you can have COVID-19 and not exhibit any symptoms whatsoever. So how do we get tested? So we have a few diagnostic tests out there, and the most prevalent are the nasal swab and the nasopharyngeal swab. And so either of these is very accurate in diagnosing COVID-19. And as you can see in the photo here, it involves a swab that is inserted into the nose for a few seconds, and then this is sent off to the laboratory to see if there's any presence of COVID-19. There's also a saliva test that we can do as well, where the inside of the mouth is swabbed. And this test is good also, and oftentimes more convenient and sometimes more easily accessible. However, it's not quite as accurate as the nasal swabs. And then there's another type of test known as the antibody test. And the antibody test is not a test to diagnose COVID-19. However, it's a test that we can order. It's a blood test that we order to see if an individual has had prior infection with COVID-19. So for example, early on, as you know, we weren't really able just to go out and get a test because there was a shortage of the test in Illinois and in many places throughout our country. So many individuals were treated as presumed COVID-19 positive and told to quarantine. So maybe a couple months later, when they found out that, okay, I'm no longer sick, but I wonder if that was COVID-19. So it's at that time when the individual could say, come into my office and say, Dr. Bell, could I have the COVID-19 antibody test? Because I think I may have had COVID 2 months ago. And that's when we would do that blood test to see if there were antibodies in their system. However, these antibodies are only present for about 90 days. So if they felt they had had the disease 6 months ago and asked for the antibody test, it would more than likely be negative. So next slide, please. So COVID-19 in Black America. So as we all know, this disease has disproportionately impacted our people. And so if you look at the schematic on the left, at the second line, Illinois. So 15% of Illinois is comprised of African American individuals. However, 42% or almost 50% of those who died from COVID-19 were Black. And if we look down to Chicago, 30% of Chicagoans are African American or Black, but 70% of the population in Chicago that died from COVID-19 were African Americans. If we look at this next slide here, it shows us similar data. So if we look at the cases of white Americans in blue, African Americans in orange, and Latinx Americans in green, you can see as far as number of cases, African American is leading the pack. Number of hospitalizations just next to that, African Americans are leading the pack. And number of deaths, African Americans are leading the pack. So next slide, please. So you may wonder, well, why is this? Why are we being hit so hard? And what we feel this is in largely relationship to are something known as the social determinants of health. And so the social determinants of health are the conditions in our environments in which people are born, where we live, where we learn, where we work, where we play, where we worship, and where we age. And that leads to many different types of outcomes depending on our individual circumstances. So when we think about these things and individuals who have access to resource and power versus those who don't, it tends to raise our risk for certain things that occur within our communities, such as COVID-19. So for example, Black people, as relates to white people, are more likely to live in neighborhoods with a lack of healthy food options, green spaces, recreational facilities, lighting, and safety. Blacks are more likely to live in densely populated areas, which increase their potential for contact with others. We, as Black people, represent about 25% of all public transit users. We are also less likely to have equitable access to healthcare. We are more likely to be a part of the essential workforce, where we represent nearly 30% of bus drivers, and nearly 20% of all food service workers, janitors, cashiers, and stockers. So during a highly contagious pandemic like COVID-19, it kind of makes sense. We're frontline, just based on our environment and the things around us. And that's why we have been, or one of the reasons why we have been so dramatically impacted by this horrible virus. Next slide, please. So now we have the advent of the vaccine, something that can save our lives, something that can save our lives. However, we're not just ready to run out there, right? Like there's this mistrust that we do see within the African American community. What is this new vaccine? We have a lot of vaccine reluctance in our communities, right? And this reluctance is for good reason. This reluctance is for good reason. So in no way do I want to invalidate the way you feel. It is for good reason. One example is the Tuskegee syphilis study, as I'm sure many of you are aware of and have heard about. So as you know, this is a study that ran from 1932 to 1972. It ran for 40 years. And the goal was to track the natural progression of syphilis in the Black man. And treatment was withheld from him. This was a huge injustice to our people in this country. Many of you are also aware of J. Marion Sims, a 19th century doctor who did surgeries on Black female slaves with no anesthesia. They experimented on us. And then we look at the systemic racism and the mistreatment that we continue to suffer from today in this country. So history has broken the trust of the Black community. So your reluctance, our reluctance when it comes to this vaccine is understandable. However, we must also understand that we are dealing with a disease that is killing us in such high numbers and is tearing apart our community. And now we do have something that can help save us. Next slide, please. So our best weapon is to be educated and informed, because good information and proper education, nobody can take that away from us. And we can make a very informed decision about this vaccine. And in doing so, save our lives, save our parents' lives, save our children's lives, our brothers, our sisters. Next slide, please. So I'd like to talk a little bit about the vaccine development process. So how did these vaccines come about, Dr. Bell? And that's the question I'd like to answer for you now. So we have 5 stages of development for any vaccine. So that initial stage is the preclinical testing. So the vaccine is given to animals such as mice and monkeys to see if it produces an immune response. And then if we're successful there, we move on to phase 1 safety trials, which is tested on a small number of people for safety and to determine just the right dosage and to confirm that it does indeed stimulate a human immune response. So if we're successful here, then we go to phase 2, expanded trials, where the vaccine is then given to hundreds of people, split into groups by age. And with phase 3, we move on to the efficacy trials to see just how well it really works, and is given to thousands of people. So in regard to the Pfizer-BioNTech vaccine and the Moderna vaccine, which we've all heard of by now, those trials involved about 50,000 people. And so your next question to me may be, well, how many of those people were Black? So we had about 10%, which is a great number. So we're talking about 5,000 African Americans were in each of these trials. And we performed the exact same way as the white people and other people in the trials. And the vaccine also protected us from this disease, as well as it protected everyone else. We did not have any adverse effects or things that happened to us that didn't happen to other people. So we did not have any particular adverse effects, and neither did anyone else in the trial. And the small number of some things they noted with, I think there was a very tiny percentage of maybe an allergic reaction, things of that nature, there wasn't any more occurring in us as them. So all in all, the vaccine worked well and very safely in us as well as them. So all of us responded very well to the vaccine in the clinical trials. So once we made it through phase 3, then the next stage is the approval. And so our first 2 vaccines, or actually now the first 3 vaccines, Johnson & Johnson, they presented to the FDA to try and get what we call an EUA, or an emergency use authorization. And an emergency use authorization is something that's applied for in a situation such as this, a pandemic that has killed over 500,000 people in our country. And of that number, a disproportionate number of that 500,000 were Black. And so they applied for an emergency use authorization so we can get the vaccine out now so that we don't lose more lives. And these EUAs, or emergency use authorizations, were approved. And the first 2 vaccines to hit the market were the Pfizer-BioNTech vaccine and the Moderna vaccine that came out in late December of 2020. And as you just heard, just this week, our 3rd vaccine, the Janssen vaccine by Johnson & Johnson, just received approval for its emergency use authorization. Next slide. So let's talk a little bit about these vaccines that are out here now. So currently available, we have the Pfizer-BioNTech, which is a 2-shot vaccine. So you receive your first shot, and then 21 days later, you receive your second shot. Moderna is also a 2-shot vaccine. You receive your first shot, and then 28 days later or so for Moderna, you get your second shot. And then we have the Janssen vaccine by Johnson & Johnson, and it's the first 1-shot vaccine. And it just recently was granted this emergency use authorization. We have 2 more that are coming down the pike in phase 3 trials, and that's AstraZeneca, which is also a 2-shot vaccine, and Novavax, which is a 2-shot vaccine. So what I'd like to do now is tell you a little bit about how these vaccines work. So you may say, well, Dr. Bell, I think I want to get this vaccine. But how exactly does it work? What exactly is it going to do? So Pfizer-BioNTech and Moderna are the same exact types of vaccines. And so you probably heard the word mRNA or messenger RNA. So Pfizer-BioNTech and Moderna are both mRNA vaccines. So let me tell you what that is. So messenger RNA is a little piece of synthetic genetic material. So many people say, so when I get this Pfizer shot or this Moderna shot, are they injecting COVID into me? Are they injecting some of the COVID virus into my arm? So the answer to that question is no, they are not. So messenger RNA is a synthetic piece or an engineered piece of genetic material. And it has been engineered such that once it's injected into our body, when we get the shot, it then produces a spike protein. So what's a spike protein? So all of us have seen the picture of the virus on television, right? Like that white ball with the red spikes coming, off of it all the way around it. But those red spikes are known as a spike protein. And this is what makes that coronavirus so dangerous. Because when it gets into our body, these spike proteins are what allows it to attach our cells and get into our cells and destroy them. So when this messenger RNA comes into our body, it produces an identical spike protein to the one that's on the actual virus. So when this happens, our body says, this is something foreign in our system. So we produce then antibodies. And these antibodies rush to gobble up the spike proteins that messenger RNA produced. So if you think back to the 80s, or was it the 70s? Does everybody remember Pac-Man? I like to use that analogy. So imagine Pac-Man on that screen, remember? On that screen, and Pac-Man is going to gobble up something. So in this case, our antibodies are the Pac-Man, and then the thing that they gobble up is that spike protein that was produced by the messenger RNA from that vaccine that we just took. So why is this important? So when these antibodies are produced against this spike protein, our body will make more and more and more of them because of the vaccine that we just got. And our antibodies just gobble them all up. And then we get that second shot 3 weeks later, and the same thing happens even more aggressively. And that's why sometimes with that second shot, people may have a few symptoms, but usually not so bad, but they may have a few symptoms that go away after just a couple of days. So now we've been vaccinated, right? So we've created all of these antibodies that are very specific to the spike protein, and then they just kind of go back, just kind of sit back in the shadows, and they just hang out. So next time you're around someone who has COVID-19 and you don't know it, but they sneeze on you or they cough on you or something like that happens and that virus goes into your system, well, guess what? Those antibodies, they're ready to go. They see that spike protein and they go and gobble up that virus, just like Pac-Man, before you ever get a chance to get sick. And that's how these vaccines will save our lives. And that's how Pfizer-BioNTech works, and that's how the Moderna vaccine works. And the Janssen vaccine works similarly. And many people have asked, well, when I get this vaccine, will it integrate into my DNA and somehow change my DNA? No, it does not. It does not. So with this messenger RNA, when it gets into our bodies and it does its job by creating this identical spike protein, and then it just disintegrates. It just goes away. It just breaks down and goes away. It just disintegrates. So it's not hanging around and it doesn't integrate into our DNA or impact any other parts of our bodies. So that's just a quick overview as to how the vaccines work. And actually, to be perfectly honest with you, it's the way all vaccines work. Now, granted, the messenger RNA is a new technology, but the work by once you get the injection, it produces an antibody or that Pac-Man response. So that later, if you were to come into contact with tetanus, if you were to come into contact with the flu, or measles, or mumps, or rubella, that if you've been vaccinated, those antibodies are already there. So you never get sick from the infection. And that's the same concept with the COVID-19 vaccinations. Next slide, please. So now I would like to take, as I close, a couple of minutes to dispel some of the myths that are that have been associated with COVID-19. And some of them I may have already answered, but I'm still going to go through all 9 here. So number 1, we cannot trust COVID-19 vaccines because they were rushed. So my response to that is many people feel that way, and especially as relates to the messenger RNA vaccines, because they are indeed our very first messenger RNA vaccines. We've never had vaccines of this type before. But what I can say is messenger RNA itself is not new. And scientists have done studies with messenger RNA for over 30 years. So we're very familiar with messenger RNA. So it's not something that we just kind of quickly developed 12 months ago in response to the pandemic. Messenger RNA, we are very familiar with and work well with. Therefore, it was not rushed. Many years have been behind studying messenger RNA. And then when it comes to the other vaccines that are not messenger RNA vaccines, they use some of the more traditional vaccine technology, such as the technology used for the tetanus shot, the Tdap, the flu shot. So, and that's the older technology. Number 2, the vaccine will give me COVID-19. So this is not true either. As I stated earlier in one portion of the presentation, so with the Pfizer and the BioNTech, with the Pfizer, BioNTech and the Moderna vaccines, those don't involve any portion of the virus at all. The messenger RNA, as I said, produces what appears to be an identical spike protein to the one on the actual virus. So when you're being injected with Pfizer-BioNTech, which I believe is the vaccine that's most prevalent now because Johnson & Johnson just came out. So the likelihood of when you go and get your vaccine, you're going to get either the Moderna probably or the Pfizer-BioNTech. You're not being injected with any portion whatsoever of the virus. Now with the Johnson & Johnson vaccine, it does work a little bit differently. So they do actually take a piece, a tiny, tiny little piece of that spike protein off of the actual virus, but it's inactivated and is not able to do anything, this little piece that they take off, but it still really triggers that antibody response. But in no way is it giving you the virus or making you sick from getting the virus. No. Number 3, we don't know what's in these vaccines. Well, actually, we do. We do know everything that's in these vaccines. And so if you were to go online or Google or even go to the CDC website, they actually list every component of what's in these vaccines. And so that's public knowledge, public information. So we know exactly what is in these vaccines, and there's nothing being hidden there. Number 4, these vaccines will alter my DNA. So I spoke to that a bit earlier too. And the answer to that is no, these vaccines will not alter my or your DNA. Again, with the messenger RNA vaccines, once it's kind of done its job of producing that spike proteins where our antibodies can go and gobble it up, then it disintegrates, it goes away. It does not integrate into any of our own genetic structure. Number 5, I already had COVID-19. So I don't need to get the vaccine. The answer to that is not true. That is not true. So basically, when you get the disease, COVID-19, you do produce what we call a natural antibody response, right? So you produce these antibodies because you got the real thing, right? Whereas with vaccines, you're not really getting the real thing, but we're able to trigger that antibody response. But we call that a natural immune response when you get the antibodies due to having had the disease. And so you do get these antibodies, but from what we have seen, these antibodies are only good for about 90 days. They're only good for about 90 days. So you're probably pretty safe that first 2 to 3 months of having been diagnosed. But beyond that, it appears to us that you are just as susceptible to getting COVID-19 as any of the rest of us. Therefore, it is important that you do go ahead and get the vaccine, even if you've had the disease. And the recommendations are, if you've had the disease, at the earliest, you could get the vaccine at about the 30-day mark post-recovery, but definitely no later than the 90-day mark post-recovery. Because after that, then your risk go back up and the antibodies aren't believed to be effective or even still hanging around much beyond that 90-day period. Number 6, this COVID-19 survival rate is so high, I don't need a vaccine. Untrue. And let me talk about the survival rate a bit. So we know that with COVID-19, 80% of the cases, people will recover and do just fine. So in other words, either they'll be asymptomatic and have no symptoms at all, or they'll have what feels like a horrible flu and they recover at home and they'll be fine. So that's 80% of the cases, which is a great thing. But then 20% of the cases are those cases that involve either hospitalization, mechanical ventilation, or being with a tube down your throat, basically in the ICU, and death. That's 20%. So what's also important about that is that even though that 80% is going to do okay, and even a decent portion of those don't even have symptoms of COVID-19, when you go home and visit mama, when you go home and visit big mama, you may not have symptoms. And you may hug and kiss your beloved big mama, but then she may be dead 2 weeks later. Because we can transmit the virus. And even if you've gotten the vaccine, which you're going to talk to in number 7, you can transmit the virus to big mama or grandmama. I call my grandparents on my mother's side, big mama and big daddy. And then on my father's side is grandmama and granddaddy, so we could tell them apart growing up. But anyway, let me not digress. So basically, you want to be sure to protect your loved ones. Just because you may do well, that won't translate into that mom and dad will do well or our grandparents will do well. Number 7, once I get the vaccine, I won't have to wear a mask. I no longer have to worry about this social distancing. I can go back to normal. Well, that's untrue. So far, that's untrue. It will be true, however, once we reach what's known as herd immunity. And many of you have probably heard that term, herd immunity. And so basically what that's saying is when we've reached about a 70 to 80% rate of numbers of individuals who have received the vaccine, we will then be felt to have achieved herd immunity, which means if we have 70 to 80% of our population who've received the vaccine, then there's a much lower likelihood that you or I or any of our family members who've all been vaccinated will encounter someone who hasn't been vaccinated and then potentially get them sick. So if most of us have been vaccinated, that's how we can then eradicate the virus and this pandemic. However, right now, like I was vaccinated 2 months ago. I had my first vaccine December 28th with the Pfizer-BioNTech, and then 21 days later, about late January, I got my second vaccine. I still wear my mask every day. I still wear my mask when I'm around my patients. I wear my mask when I'm around my friends. Many other individuals have not received the vaccine just yet. And so even though I am protected and I'm fine, still, if someone coughed or sneezed on me and I had the vaccine anywhere on my person, on my hands, and I shake your hands, even though it's not going to get me sick because I've had the vaccine, I could get you sick. So that's why it's still important that even though I'm protected by the vaccine, I still need to wear my mask so I can protect you. So we still have to wear our mask and we still should socially distance for now until we reach that herd immunity threshold, which is about 70 to 80% of our country in this United States having been vaccinated. And right now, I'm not sure where the percentages are. We might be at about 15%. So we have a long way to go. Number 8, now that we have vaccines, the pandemic will be over real soon. Well, I wish that were true. So we have vaccines, but we have to get them into the arm. We have to say, yes, I am going to get vaccinated. I am going to do my part in helping to end this pandemic and save the lives of my family, my friends. And so, yes, we have the vaccines, but we have to go get vaccinated. And as we go and get vaccinated, then we will begin to the process and the steps of moving back towards normalcy. Number 9, the vaccine will cause infertility. We have no evidence that this vaccine will cause infertility. And they are continuing to look at that to see if anything changes as in regard to that. But as of now, we have no evidence whatsoever that by taking this vaccine, it will make a woman, or a man for that matter, infertile by impacting the woman's eggs or the man's sperm. So we have no evidence and have not seen that in the cohort that has been tested thus far of infertility. So that is untrue. So this brings me to the close of my presentation today. I hope that I have answered many of your questions, that I have addressed many of your concerns. And next slide, please. I have a few conclusion statements. So masks continue to be our best weapon for preventing transmission of COVID-19. Black America's mistrust of the healthcare system is understandable based on our history in this country. Education is our most potent weapon, and no one can take this away from us. Misinformation is our greatest enemy. And mass vaccination is necessary to save our lives. So this concludes my talk, and I'm going to turn it over to Ms. Gwen Butler. Thank you so much for listening. Thank you.
My time is all off, but good morning, everyone. I'm Gwen Butler, Director for Environmental Health and Safety, and I'd just like to thank Northwestern Dining and Compass for hosting this webinar. I hope that each of you are finding it very helpful, and I hope that you will share the recording with your friends and your family. There have been a couple questions that were forwarded on that are on the screen right now. And the question, there's a question about whether the vaccine will be mandatory. Similar to other vaccines that are available, such as the flu, the measles, the mumps, all of that it's not mandatory, it's not required, but certainly we encourage people to take the vaccine, to receive the vaccine, because it will ultimately save our lives, but it's not mandatory. Will you be paid to get a vaccine? And I think Georgine or Jennifer will address this more specifically regarding Northwestern Dining and Compass, but I will tell you that Northwestern or any other employer is not paying individuals to receive the vaccine. That is a personal choice, and as I said, we encourage people to do it, but you will not be paid for it. Now, the question about should I sign up in the city and county where I live? Yes, you should. So there are a lot of different options to receive the vaccine. If you have a provider, if you, for instance, if you have a doctor at Northwestern or North Shore, your provider will reach out to you once you meet that category. So I think currently we're in 1B. So if you're considered a 1B essential employee and you are over 65 and you meet that criteria, your provider will reach out to you. You can sign up with your provider. But there's also methods to do it through the city and the county. So if you are a resident of the city of Chicago, you can go on a website, and I believe we have the next slide that has that information, but you would sign up on ZocDoc, or you can call 311 or 312-746-4835 to sign up for an appointment. In addition, the city of Evanston also, I know Northwestern sent out an email a few weeks ago and encouraged people to sign up on the city of Evanston's Department of Health and Human Services vaccine contact form. So once you meet the requirements for the vaccine, meaning if you're in 1B or 1C and beyond, they will contact you. And then there's also Cook County. So there are lots of different methods. In addition, just recently, the United Center, it has been identified as a mass vaccination facility. So it doesn't matter where you live in any county that you live in, it's open to any resident in the state of Illinois. There's also one in Des Plaines too, with the same thing, but you have to go online or call one of these three numbers so that they can contact you once you've met that criteria. And I think the next question, I think that's the next slide about Northwestern and Northwestern's vaccine distribution plan. So there are a couple questions in the Q&A. I think there's one about will Northwestern offer the vaccine? So currently, Northwestern is an approved vaccine site. However, as you know, and I'm sure you've heard on the news, the supply for vaccine is not quite there yet. And also we have to work with the state of Illinois and the local health departments, such as the Evanston Health and Human Services, to identify how much of that supply we'll get. In addition to that, we have to work with them on the notification for that. So Northwestern is not independently doing this. We are working in conjunction and in collaboration with the local health department. So as soon as we get more information, we will definitely share that information with Compass and with all of our Northwestern faculty, staff, and students. But if you have any additional questions about it, you can always, reach out to myself or Jennifer and Compass, or you can visit our COVID-19 website specifically on the vaccine distribution if you have any questions. And I think I'm going to turn things back over to Georgine, or if we're ready for the Q&A. I think there are a couple questions, or if there's anything else that we want to talk about for the rest of this webinar.
Thank you, Gwen. Yes, so we do have one question for Dr. Balark. Are you aware of any consequences in the future once you receive the vaccination?
Thank you for that question. As of now, no, we're not aware of any future consequences, but what I can say is that those individuals, that 40 to 50,000 that I told you have been in these clinical trials, they're still being followed. And so we're speaking of individuals who received these vaccines probably back around the July-ish time frame, if you will. And so it hasn't even really been a full year yet, but they're continuing to be monitored. For example, say a year out now, their blood tests will be checked to see, how strong is the antibody response. Will this be a vaccine where we may need a booster in the future? So they're still being just monitored for how the vaccine is working and the effectiveness of it as time goes forward. So a lot of this is also still being done in real time.
If you don't mind, Georgine, I have a question for Dr. Balark, and you may have mentioned this. Can you tell us about your experience with the vaccine?
Oh,
Would you mind sharing that?
Oh, no, I'd love to. One thing that I would like to share that a lot of people don't know, and I said I think it would be good to share this with others, is that, so when this vaccine first came out, I'm a physician. I've been practicing 20 years. And when it first came out, I felt a little uneasy. I had a little vaccine reluctance. I have to be honest with you. I did. And I said, okay, how do I overcome this little bit of fear, like of this is different, this is new? And I said, well, I got to educate myself. I got to really learn more about this. And that's what will make me feel more comfortable. And so I did my research and I read on it. All the things that I shared with you guys today is the stuff that I was reading that really kind of brought my heart rate down and made me feel, okay, this is okay. I signed up right away. I got my first shot on December 28th. And so with the first vaccine, I got it at Northwestern, and the first vaccine, and it was the Pfizer BioNTech that I received because that was the first one that was out and the only one that was out. And I just experienced pain at the injection site. So, it was given to you in your arm and your shoulder area, and I had pain at the injection site. And actually, for me, the pain was fairly significant. So I did take a couple of over-the-counter ibuprofen or Tylenol, and that totally managed that. So that was it with the first one. And then with the second one, I had a few more symptoms, but not really so bad. With the second one, I experienced a lot of fatigue. And initially, I was thinking, well, I've just been working really hard this week. Instead of my 10-hour, 12-hour days, I did a couple 14-hour days. I was just thinking that maybe I was just working really hard that week. I'd had some low-grade nausea, mild nausea, some mild headache. And that was about it. And then day 3, when I woke up and felt like I was ready to run a marathon or something, I'm like, okay, I don't think it was just from working hard this week. That fatigue must have been from the vaccine. So those were my symptoms. All in all, I did pretty well with it, nothing significant at all. And that can range for other individuals. Some persons with their second shot still just get no symptoms at all. And others may end up with maybe a fever of 101, some muscle aches, and it lasts for maybe 2 days. And then the next day they feel like nothing ever happened. So, or you could be somewhere in the middle like me. But all in all, the experience was very positive. And of all of my friends and colleagues, which hundreds of them who have gotten the vaccine, I have not heard anything terrible, that happened. Just things like what I just said.
If you don't mind, I have one more question, and this is just based on the news. So I want to say in Wisconsin, maybe the I think it's the governor or the mayor of a city in Wisconsin was offered the Johnson & Johnson vaccine, and he turned the supply down for his city and indicated that the Moderna and the Pfizer BioNTech are the better ones. So I'm sure a lot of people have this question, which one is better? Is it the Pfizer? Is it the BioNTech? Is it the Johnson & Johnson? And do I have a choice in which one I receive?
Wow, that is such a great question. And I actually meant to address this earlier. So thank you so much, Ms. Butler, for asking that question so I can address that. So first off, let's talk a little bit about efficacy. And I won't go too long here, but okay. So Moderna and Pfizer BioNTech, those two vaccines are at reported at about a 95% efficacy as far as preventing, COVID-19. Johnson and Johnson's their Janssen vaccine is a bit lower, so its efficacy is of about 72% in regard to prevention of COVID-19, and it is also reported to be 85% effective against hospitalization and 100% effective against death. Also, I want to say about Johnson & Johnson, and so maybe why their percentages are a little bit lower on the overall efficacy, that 72% I mentioned. So Johnson & Johnson was also tested in the UK, in South Africa. And so we know that there's some variants over there, right? That's different from the standard or that initial strain that's a little bit harder to kind of hit, if you will. And so if you look at how Pfizer and Moderna, their effectiveness against some of these variants, they fall down to about 70%. And so I want to say that Johnson & Johnson's part of the reason for their lower efficacy is that they were tested against a broader range that included some of the variants as well. I personally think, as a physician, I think that that Janssen's vaccine is an excellent option, right along with Pfizer BioNTech and Moderna. And so when people say, well, which one should I get? I say, get the one that's available. There's not one that I say, oh, go and get this one or don't get this one. No, I think they're all great vaccines and they all have their strengths and they all definitely offer protection. And I think when we think about the endpoints of death and hospitalization with potential mechanical ventilation or a tube in our throats, I think those are really like the main two things that we definitely want to make sure don't happen. And so with the Johnson & Johnson vaccine, it's 100% effective against anybody dying. No one died in their studies. And then 85% plus against hospitalization, mechanical ventilation, things of that nature. And then 70% against more so that milder type of disease or like you're at home, from like the flu or something like that. So 70% that. So I do think though that all three are great. I would get the one that is available to you.
Thank you for that. And also too, just to note, sometimes we don't have a choice, correct? And the vaccine that's going to be provided. So if
you don't have a choice, right, you don't have a choice. So say for example, if my patient called me and said, hi, Dr. Bell, I do want to get my vaccine. I just want to let you know that I want the Johnson & Johnson. So then I would have to call back and politely and respectfully say, I'm so sorry, Ms. Jones, but you don't have a choice. Northwestern has this vaccine, and so this is one that we will be giving. Now, some people may choose to kind of, hop around and see which one Walgreens has. If they're in that tier, you could go through a Walgreens, or you could go through, the state site that Ms. Butler mentioned earlier. But the bottom line is you don't want to delay getting your vaccine if you have the opportunity to get it, and all of them are great. So get the one that is available to you in the most efficient amount of time, because I actually had a friend who actually qualified to get the vaccine. but she moved a little slow on it, and she didn't go and get it just yet. And she ended up getting COVID in that time period. And thank God she did well, but she gave it to her husband, her 4-year-old twins. You know, I'm just saying, don't delay. If you have the opportunity to get the vaccine, don't go shopping around. They're all great vaccines. Just go ahead and receive it.
Thank you for that. That was my last question. Thank you.
Thank you, Gwen. If there are no other questions, we wanted to just take a moment and thank Dr. Balark and Gwen Butler with Northwestern University. And thank you to our associates who joined today's webinar, and everyone enjoy their day.